Traditionally, what is the goal that patients have in a dentist's office? Is one, they want their teeth to look good, right? So one of the things that we can do is when patients have periodontal disease is we can do this in a non-invasive way. That's not only easier for the patient, it's quicker, we can do more teeth at once, we can get the patient stabilized, make sure we're saving teeth, then we have the ability to get that patient back to you to address these cosmetic concerns. Crown, bridge, fillings, orthodontics, whatever we need to do to make the patient happy that way. So as long as we take care of the underlying issue first and do it in a way that's going to be easy for me, it's going to be easy for the patient, and easy for them to get back into your office, we're all going to benefit. Because we've seen so much success utilizing laser therapy in my office, we're going to be offering events in the future to talk about this technology. What does the patient go through in order to get their periodontal disease stabilized? What's so important about that is then once that stabilization occurs, we can get the patient back to you, into your office. So what does that mean? It means one, patients are going to be healthy, and two, your bottom line is going to be increased.